We're going to talk about in this video basically what to expect after fillers. Okay, now there's all different types of fillers out there. My workhorse treatment is going to be RESTYLANE and PERLANE, and I also use RADIESSE as well. I'm going to talk about those separately so that you understand what my philosophy is in terms of what you need to know after a treatment. Basically, you've heard in my other videos, I don't use a lot of needles. I use cannulas, which are very soft, so the chance of bruising is a lot less. At the same time, you could bruise. I can't predict it. I can't promise you. That's why you want to review that medication to avoid sheets so that you don't get in a situation where you get a lot of bruising. And certainly don't do this a week before a major social event. At least give yourself 2 weeks. That's the best idea. Of course, if you give me a shorter time and you're reasonably expecting, and you're reasonable to say that, you know what, it's not a major social event, you want to take a little risk, of course I can do it for you, but I would ask you at least 2 weeks before a major social event if we're going to do a fill. Also remember that if you're looking for a wedding or other thing is, you also don't want to do this 6 months before because you can have some of your fillers start to dissipate. Ideally, what I always say is about 3 to 6 weeks in advance. You can do this probably a month before would be ideal so that you can get maximal results and minimal dissolution of the product afterwards. The things that I see, especially filling around the eyes and cheeks, is that there's about 50% of my patients that are in love with it. They go, oh, this is so great at one day, and then they're disappointed a week because the swelling is more like fat grafting. And that's important to understand that with 3 or 4 cc's of RESTYLANE, I've got to make it look like 40 cc's of fat. Very hard to do, but I know how to target major zones to get you a good result. And that's important you understand that distinction is that it's not going to be equal to fat grafting, but it's going to be an approximation of it. And that's very important. So what I see is a couple responses emotionally with my patients. One is the fact that they feel like, you know, it's perfect, it's beautiful, I hope it doesn't go down. It's going to go down a little bit because that's swelling. Or the other thing they see is, oh my God, I look distorted, this is weird, what's going on, my cheeks are too big, you know, one side's bigger than the other, what's going on with this? My eyes look more sunken. Sometimes the lower eyelid can look a little bit more sunken, even for 2 to 3 days. That is all normal with RESTYLANE or hyaluronic acid products, so that's something you need to know. So I would always say 50% of my patients are absolutely in love with it at day 1 or 2, but don't be in love with it because it's going to come down and it's not going to be as impressive, but still beautiful. I mean, stunningly beautiful, but not quite that swollen look that's equal to fat. Or if people only see the distortion, they're going to be very fearful that, oh my God, this looks terrible, but that usually goes down in about 2 to 3 days. With cannula, sometimes you can feel a little bit of tenderness or soreness, not pain, but just a little soreness that can even last up to a week in the areas that are treated, and that's something you need to know as well, but it's not very common. The other thing that's going to be important is that a lot of people go look at the asymmetries. Oh my God, this is bigger than that. It's the swelling, and oftentimes when I come back and show you the before photos, you'll see that you were completely uneven before, and now I've gotten you much closer to becoming more even. You just don't notice that. You always look at the symmetry beforehand as if, oh my God, I was perfect before, and you weren't. You just never noticed it because you never looked so carefully. I ask you to review the video on self-perception about that because that's going to be important for you to think about. That's important you understand. And also, if there's anything that's not quite perfect with RESTYLANE, PERLANE, I can dissolve it, so don't worry about that. I can manage most of everything, and that's what's great about it. RADIESSE, I can't reverse, and so when I do RADIESSE, where do I do RADIESSE, first of all? RADIESSE is really for deep folds, for volume, for areas that if you can't have fat grafting, I do RADIESSE because that way I can't really convert someone from RADIESSE over to fat very easily. I have to wait a long time to do that, and so I prefer not to use that product. I do RADIESSE in the hands as well. It's a good treatment for that area. But essentially with RADIESSE, and I'll consult with you to have you understand what the differences are. This is a video that involves the afterwards, so you understand what to expect. With RADIESSE, I almost insist on you coming back at a week, especially with volume contour, because I can still shape the RADIESSE after a week. After 7 days, I really can't do much with it. With RESTYLANE, it's not so big deal, but I usually see all my patients back at a week so that I can just evaluate if the result is good enough. So hopefully that's a short summary of some of the motions and thinking that you may be going through following filler treatments.